Hello and welcome to our channel. Today, we're diving into the world of molecular diagnostics with a focus on the FISH MDS panel chromosomes 5q, 7q, 8q, and 20q test. This test plays a crucial role in diagnosing and predicting outcomes for myelodysplastic syndromes, or MDS. Pre-test information. Before we get started, it's important to note that no special preparation is required for this test. It's a relatively straightforward procedure, but its implications can be significant. Specification of the test. The FISH MDS panel chromosomes 5q, 7q, 8q, and 20q test is a type of fluorescence in situ hybridization, or FISH, test. It's used to detect specific chromosomal abnormalities associated with MDS. Diseases associated. MDS refers to a group of clonal hematopoietic disorders that result in ineffective production of myeloid cell lineages. MDS increases the risk of transformation to acute myeloid leukemia AML by 35–40%. Specimen used. The test typically requires a specimen of bone marrow. Components of the test. This test looks for abnormalities in chromosomes 5q, 7q, 8q, and 20q. These chromosomal regions are commonly affected in MDS patients. Chromosome 5q, deletion in the long arm of chromosome 5 is seen in approximately 30% of MDS cases. Patients with this deletion often have a favorable prognosis. Chromosome 7q, monosomy of chromosome 7 or deletion of 7q is associated with poor prognosis and a median survival of less than 1 year. Chromosome 8q, Trisomy 8 is a common abnormality in MDS and is associated with an intermediate risk, with a mean survival of 23 to 26 months. Chromosome 20q, deletion of chromosome 20q is seen in a subset of MDS patients and is associated with a favorable prognosis. Test report time. The test report is usually available within a few days to a week, depending on the laboratory. Test information. Myelodysplastic syndrome MDS is a group of clonal hematopoietic disorders that result in ineffective production of myeloid cell lineages. More than 50% of patients with MDS have clonal cytogenetic abnormalities, which can be classified into 3 risk groups based on prognosis. Good prognosis. Deletion in the long arm of chromosome 5 and chromosome 20q is seen in approximately 30% of cases and is associated with a favorable prognosis. Intermediate risk. Trisomy 8 is associated with a mean survival of 23 to 26 months. Poor risk. Monosomy 7 and complex chromosomal abnormalities are associated with a median survival of less than 1 year. Conclusion. In conclusion, the FISH MDS panel chromosomes 5q, 7q, 8q, and 20q test is a critical tool in the diagnosis and prognosis of myelodysplastic syndromes. It helps clinicians determine the appropriate treatment strategies and understand the likely course of the disease for their patients. Thank you for watching. Don't forget to like, comment, and subscribe for more informative content like this. See you next time.